Hey, Coach Terry here, and I am going to be speaking with Dr. Fred Dietzen this afternoon. He's an amazing doctor of chiropractic who has a unique specialty, and we're going to learn all about that today. So let's go on in.
Hi there, Coach. Welcome back to the office.
Okay, here's Dr. Dietzen.
Yes.
All right, good to see you.
Good to see you too. Thanks for coming, Coach.
Okay, now how about you show us around and
Absolutely.
let
Love
us
to
know
show
what
you
you do.
the office. Love to
Okay.
show you the office. This is our reception area. People are welcome to get a drink of water or some tea, have a seat and relax while they're waiting to get assessed and do their correction. Come on back and I'll show you the office.
Great.
So one of the first things that we'll do after doing a correction, we're doing a lot of neurological input. People feel different, they're more rested, and we let them come in here to our NASA designed chair, put them back in a perfect position relative to gravity. And a lot of people like this feel that this is one of the best things for them. We just want to make sure that people are integrating this change. Okay, and I'll take you back to the X-ray suite. This really is what separates us from many other chiropractic techniques. And as far as I know, the NUCCA practice is the only practice that will look at 3D X-rays, take a precise and accurate listing for each individual person, so it's all customized. And we have certain tools in here that allow for us to not only take very precise X-rays, but take precise X-rays after the correction. And that's really what makes us different, because we're able to look that closely and see what's changed, what hasn't. Gives us a lot of objective measurements and allows for the client and patient to really feel better after the correction. And we can modify and adapt what we're doing so that people are able to get rid of the pain faster, so that physiologically things are better connected and working more efficiently.
Right, and I've had some experience in how precise you are in aligning the patient with, the X-ray so that it goes exactly where you want it, and that was pretty impressive. Okay, so and that allows you to make more specific diagnoses that will be beneficial to the patient. Is that right?
Absolutely, yes.
Okay.
That's a very good point. Because we're not doing any pushing, we're not doing any turning, twisting, popping.
Yes.
It's all predicated on being very precise, extremely precise, so that the vector that we choose for each person, so that it's customized, we are able to make a change and affect change to the entire body by making a correction at the top of the neck. The hips, pelvis, legs all balance out, and the reason we're able to do that is because we're so precise with how we're going about making the change and affecting the change in each individual's body.
Excellent. And the way you make that change is over here in the other room, right?
Right back
with
over
some
here. That's
pretty
right.
specific equipment.
That's right.
All right.
So a couple other things. We have our adjusting table down here. You were talking about some of the equipment. We're able to make the change with physics, geometry, proper placement, and coming up with a mathematical vector for each person. So we're using potential energy, we're using gravity to make changes and affect changes from the first set of X-rays that we have on top to the second set of X-rays on bottom, and we can confirm those up to about 1 millimeter. Now, some of the things that we'll do in terms of checking how people are doing. You looking at the X-rays?
Mm-hmm.
Okay.
And now we're coming over here. Okay, go ahead.
Yeah. So this is a side view. Teeth are here, eyes are here, and we're focused in on this area, the atlas, the first and freely movable bone in the spine. Next through this plane line, we're going right through and looking at the relationship of vertical relationship from the head and neck, and we're also doing some calculations across horizontally as well. This is the third shot. It's going right through the top of the head. Teeth are here, nose, and we're looking at the alignment of the atlas These are actually the second shots that we took. The first shots that we took were here, and you had a rotational factor 1.5 degrees, made a correction after the first adjustment. It was posterior 1/2 degree, so we moved it almost 2 degrees. There was some acute angles here that we were able to clean up and bring this on a more vertical axis.
And that translates to, what does that do for the body once you get that moving better?
Yes, once that's moving better, we're always in the gravitational field every time that we're standing, sitting, anything that we're doing. So if there's any sort of misalignment here, then it's going to affect everything down the chain. And so that interrupts some of the signals. It could interrupt some of the processing and information from the brain to the body, and the body back up to the brain. Often results in knee pain, hip pain, back pain, neck pain, physiological problems like blood pressure, breathing problems. So when we get this corrected, and this is at ease and in a better position relative to body, relative to gravity, then the body's able to heal more efficiently and effectively.
Could you explain what you mentioned about the horizon line and how that affects?
Sure. So typically what happens if there's a trauma or there's an injury and it shows up in the top of the neck, let's say, I'll visually show you, somebody ends up with a head tilt from snowboarding, they've hit their hip and it resulted in an injury up here. They may have a head tilt. Nobody really walks around like this. What they do is they'll unconsciously move their body in a position so that their eyes are more on the horizon. So a shoulder may go up, hip may go back, and that twisting and that turning of the spine and the rest of the body will often show as one hip being higher or lower, one leg being shorter or longer, and causes pain and wear and tear in different parts of the body. It's different for everybody. So when we make the calculation, correct this, then the eyes no longer have to be in this position. The body no longer has to react to this new position, and people relax and go to a more balanced state.
So those are just wacky compensations for a not exactly straight horizon line due to, something that happened.
A lot of times. And it's not the case every time, and that's why it's important that people get checked. Make a determination by somebody who's trained to do it, and look and see if that's what's causing their problem. It's not always the problem, but it's a very common problem, and it affects a greater portion of the population than we're able to address and help at this point. We need more people doing this type of work and looking for it.
Right. You have one more really interesting looking piece of diagnostic equipment here.
Yes, absolutely. This is the anatometer, and people will stand facing forward. This is some of what I talked about earlier in terms of how people show up with hip heights that are not the same. We also have a scale back here so that I can see if somebody has pushed one hip back relative to the other. And it's interesting because I'll have people look straight ahead and have them stand straight up, and they feel like they're standing perfectly straight. But this will often tell a different story.
Right.
We also use this laser here to look at the base of the neck, the junction of the cervical vertebra, the neck, and the thoracic vertebra, and it'll tell if there's any sort of lean from the left to right. So not only do people come in and use our hands to see if there's a problem at the top of the neck, we have the x-ray, we'll check leg lengths. Most people don't actually have a short leg, they have a pelvic distortion that's causing an apparent short leg. And then we'll have people step up here, and we'll have another tool that we could utilize to see what kind of twists and turns in the body.
Right. So you have a lot of objective input rather than subjective, and then you have the art of how you apply it with what is probably the most gentle type of care that I've ever experienced, but extremely effective in its own right.
Yes. Thank you. You said it very well. Yes, thank you, Coach.
Great. Okay. Well, thanks for having me in here and explaining all this. And
yes, thank you, Coach.
Okay. I'll look forward to seeing what kind of feedback we get.
Yes, I appreciate it. Thank you.